Hi everyone, this is Sandra Gomez-Perez. Thanks for joining and tuning in. This is a tutorial, a very short video on the anatomical features on computed tomography images at the third lumbar and also examples of difficult images. These were questions that were asked of us when we published the original tutorial in JPEN for how to use ImageJ, the NIH ImageJ software to analyze skeletal muscle and abdominal circumference. We have since then published a revision or a version 2.0 of the tutorial in JPEN as well, and that was published in 2019. But this short video is a follow-up on some of the questions that we got from some of the individuals who were trying to use the protocol. So let's get started. So in order to understand what is normal or abnormal and what is artifact in a CT image at the third lumbar or at any particular slice or landmark, we need to understand what normal is, what normal anatomical structure is. And so in order to do that, we have to have good knowledge of anatomy at the abdominal level. We also we need to understand that the anatomical features seen at the L3 landmark within the intra-abdominal cavity varies from person to person. Therefore, the L3 images taken from two different people will appear very different. And so some of the images that we'll present here today, you'll see the variation. And so I'm just going to talk about some common things that you would see or might see. But again, it's going to be very different from person to person. So what else can we do to understand normal versus not normal? Well, practice. The more you practice looking at these images, the easier it'll be to identify what's common an anatomical feature and what isn't. And always remember that when in doubt, even if you have a lot of practice, ask a radiologist or ask someone who has been doing this a little bit longer than you have, just to kind of help you out. So this is what a CT image of the third lumbar looks like. Again, this is the lumbar vertebra, third lumbar vertebra here, and it's probably the most distinctive feature. And we're going to go through some of the common anatomical features we see here. So these are all the anatomical features in this image, and these are some of the possible things that you could see. And this is a pretty busy slide, so we're going to split this up a little bit. So we're going to talk about the right side here. And we have the duodenum, we have the liver, we have the ascending colon, we have a little bit of the pancreas, the duodenum, the right kidney, the inferior vena cava. And these are some of the things that you could see. Again, the vertebral body is going to be probably one of the easiest things to identify. So let's look on the left side. So the linea alba is actually something you can see on both. You can see it here. The linea alba is labeled here though. Here's the stomach, the jejunum, the superior mesenteric vena cava, the superior mesenteric aorta, the ilium here, abdominal aorta. Again, the vertebral body, very easy to identify, and then the left kidney. Again, these are some common features. It doesn't mean that you're going to see this in every single image of a person you see, but at least these are some of the things you might see. So there are some things, though, that are going to be pretty constant from image to image, and these are the abdominal circumference, the location of the subcutaneous adipose tissue, the location of skeletal muscles, and the location of intra-abdominal cavity, and where you find the visceral adipose tissue. So let's look at those. Okay, so here you have the abdominal circumference, you have the subcutaneous adipose tissue, you have the intra-abdominal cavity highlighted here in yellow, you have the visceral adipose tissue where you find this darker gray area, sometimes very hard to identify. And then the skeletal muscle is between the subcutaneous adipose tissue and the intra-abdominal wall. And it's this lighter gray color, and I'm going to try to highlight it all the way around. But we're going to take a closer look at that in the next slide. So these are, again, common landmarks that you can identify very easily. So the abdominal circumference, subcutaneous adipose tissue, the visceral adipose tissue within the intra-abdominal cavity. And then the final thing, the most important aspect of this tutorial is trying to identify the skeletal muscle, which again I've highlighted here with my pointer as I'm talking in this light gray areas. So again, skeletal muscle is the most important aspect. It's what you're trying to identify, and understanding and identifying this will be easier with practice. These are the major abdominal groups at the third lumbar vertebra: the rectus abdominis, the internal and external obliques, and transversus abdominis on both sides here of the abdominal wall. We have the psoas hugging the vertebral head. We have the lumborum, quadratus lumborum on both sides of the vertebral body, and then we have the erector spinae. Again, these are the common skeletal muscle groups at the third lumbar vertebra. Here's another slide showing those skeletal muscle groups, and this very different from the previous slide, where we have an individual with a lot less skeletal muscle, and this is the one that I was just looking at before. And again, the muscle groups are located in the same place: the rectus abdominis, the internal external obliques, transversus abdominis, the psoas, the quadratus lumborum, and the erector spinae. So it's quiz time. Can you locate the skeletal muscle in this image? I'll give you a few seconds, and then I'll just highlight. So the skeletal muscle is a light gray, so it's right around here where I'm tracing with the pointer as best as I can. Sometimes it's easy to start with the abdominal circumference, subcutaneous adipose tissue, and boom, here's the skeletal muscle. Vertebral body is also a good place to start. You start here, you identify the muscle groups that are attached to the vertebra, and then you can work your way out. How about here? Can you locate skeletal muscle? So again, I'll do it quickly. Again, it's just to give you an idea, right? Here's another slice. Can you locate the skeletal muscle? All right, so here it is. I'm going to highlight it with my pointer just to give you an idea. Can you locate the skeletal muscle on this one? Give you a few seconds. Easier to start here with the vertebral head and then work your way out. Then hug around the abdominal wall. You can start from the abdominal circumference, the subcutaneous adipose tissue, and then here's the skeletal muscle. Either way, it'll be easier and easier as you continue to do this. How about, can you locate the skeletal muscle here? Okay, so here it is, skeletal muscle, and I'm tracing as best as I can. And the last image, can you locate the skeletal muscle on this end? Okay, give you a few seconds. And then we can start here, and then the muscle groups hugging the vertebra, and then all the way around. If you notice from image to image, there's a lot of differences, a lot of variation. So the more you look at images, the more you practice, the easier it'll be to identify the different things that you're looking for, especially skeletal muscle. Okay, so now let's talk about some difficult images and what to do, or how to do, and how to analyze it if you can. So decisions on whether to use poor quality CT images should be done on case-by-case basis. Some images may be used for both abdominal circumference and skeletal muscles, some for neither, unfortunately, some only for skeletal muscle. Images reviewed here are only a small sample of some possible difficult images that we have encountered. Use your best judgment and discuss poor CT images with a radiologist or with someone who has a little bit more experience to make a final decision regarding its utility, whether or not you should use it. So some common things, distortions on CT images that I've encountered could be due to artifacts such as vascular stents, IVC filters, cutoffs on left and right side. This is very common due to scanning procedures. Sometimes individuals with obesity may have CT images that have cutoffs on either side or both sides. And again, I'm just going to give you a small sample of images that could be difficult to analyze or even impossible to analyze. So this one individual here was unable to raise their arms over their head during the CT scan, and this produces these streaks going through the level of the arms going through the spine. In this case, also there's a lot of calcification, the aorta. There's also a lot of streaking and blurriness, and according to the radiologist, this patient may have been moving during the scan, and so this creates this sort of fuzziness and blurriness. Again, use your best judgment on whether or not this would be someone who you would want to scan and analyze, spend some time analyzing an image for. Very, very difficult. So here's another image, and one of the questions we've had to deal with in our group is whether or not this is muscle or not muscle. And the answer is this is not the muscle is here. This is anasarca, fluid accumulation, fluid overload, or it could just be the individual spends more time on one side of the body than the other, and so it creates this fluid accumulation. Here's another image. This person has ascites. It's a very common thing we encounter in some of our patients. But here, another big common question that we always have to kind of think about and look at these images carefully is, where is the, where is the muscle ligament end? And so again, this is not muscle here. So very carefully, we have to make sure we understand where muscle is and what muscle isn't. This next few slides are going to be examples of images with cutoffs. Again, these are cutoffs on both sides of the image. Inaccurate abdominal circumference, skeletal muscle is okay to assess. The image J protocol is using differences, and so we're able to generate the skeletal muscle mass from that derivation. However, we wouldn't be able to use this for abdominal circumference. So again, this is an inaccurate abdominal circumference because we have cutoffs on both sides, but we would be able to calculate skeletal muscle. It's very close here, the cutoff, but it's not at the skeletal muscle, which is actually a good thing. So we would be able to use it for skeletal muscle assessment. This individual, again, cutoffs on both sides, inaccurate abdominal circumference, but we would be able to analyze for skeletal muscle. And then a common question, some of the people who are working with us, is this muscle? And the answer is yes, this is muscle with very high fatty infiltration. And then the last image that I have is probably one of the most difficult images we've had, and it's an individual with an ass scanning that has cut off both sides of the body, and it also cuts into the skeletal muscle here. So in this particular image, we would not use for skeletal muscle estimation. This person also has a right psoas hematoma, which could dramatically affect your findings. And again, we have the question of where is the muscle end? Is this where it ends, or is it here? And the answer is this is where the muscle ends here. This is the ligament here. It's just fatty infiltrated. In this particular case, we would not use this image where the muscle is cut off, which is here, and where the muscle is affected in some way. So I hope I've been able to give you some ideas of what to commonly see, but also some of the difficult images that we have encountered. I want to thank Liam and my colleagues, Winnie and Bama, who assist us with body composition using CT imaging. Thanks for watching and good luck.